cystitis. You know why women are more prone to cystitis. They have a shorter urethra. The urethra is actually part of the anterior wall of the vagina, and so stuff can get milked back up into the urethra with sexual activity or with anything else that is manipulating the tissue. Okay. Now, that being said, even if bacteria lands in the bladder, it can't necessarily do anything. Okay. The urine coming down is sterile, and it's usually very acidic. Not necessarily, depends on what a person's been eating and the rest of their body balance, but usually the urine is fairly acidic. And it's continuously coming down through the system. So if a person is emptying their bladder frequently, typically anything that gets worked back up into the bladder is going to be washed away, even though the urine is a great bacterial culture medium. Okay. However, there are some bacteria that can invade the mucosa, or there are some bacteria that can actually stick their little fimbriae out and glom onto the mucosa. Okay? E. coli is particularly notorious for that, having fimbriae that can actually attach themselves to the transitional epithelium in the bladder. When you have urinary tract infections in a prepubertal girl, okay, you need to consider sexually transmitted things. You need to consider whether they have been, playing with themselves, sticking things where it should not be. Okay. But also, you need to consider that they may be genetically susceptible. There are some women who have a genetic picture that their receptors match up to E. coli fimbriae very easily. Okay. And those women tend to have recurrent urinary tract infections, and they tend to, sometimes even start in little girls. Most of the time, though, with little girls, the type of vaginal and urinary tract stuff you have is irritative, which means that either they haven't been as clean as they should be, or they've been playing where they, shouldn't be, or, things like bubble bath, or sand, or, all of that kind of thing. Okay. Now, for you guys, cystitis is important because under the influence of progesterone, all of smooth muscles get a little lax, and that includes the smooth muscles of the ureters. So cystitis can ascend to the kidneys, which would produce pyelonephritis. Now, tell me what the symptoms are of cystitis.
Urgency.
Okay, tell me what the real words are for those. Dysuria. Urgency. Frequency. Okay, all right. And pain, suprapubic pain. Okay, sometimes suprapubic pain, sometimes a fever, sometimes blood in the urine, okay, or difficulty getting the stream going. Okay. Now, what are the symptoms of pyelonephritis? Okay, CV tenderness, okay, fever. Now, sometimes, especially in older women, you'll get a picture that looks an awful lot like gastroenteritis. Okay? So if you have somebody who's throwing up and you can't figure out any other reason, do a urinary tract, do a urinalysis. Okay? All right, so what do you do about it? Antibiotics, okay? That's usually the easiest and quickest way to get rid of the infection. What antibiotics do you use?
Depends on what the organism is.
It depends on what the organism is, okay? What most practitioners will do, and there's argument about this, what most practitioners will do is use some fairly broad spectrum antibiotic that covers gram negatives, okay? And if that fixes the problem, well and good. Okay? if you have somebody with a history of repeated urinary tract infections, it may be worth the time to do a culture, okay, and then start your broad spectrum, and then switch to a narrow spectrum. Okay, you'll see it done both ways. The problem is if you go ahead and treat them empirically with something, okay, then you can't go back and do a culture because you've completely muddied the picture now of what it is you've got. What are some of those drugs? What are some common drugs that are used for urinary tract infections? Okay, Bactrim or Septra, which is actually what? About this long. Trimethoprim sulfamethoxazole. Okay. Bactrim and Septra, that's what they both are. Okay. What else? Macrobid or macrodantin. What's another one? Sometimes Catholics and stuff is used. Nitrofurantoin is another one that is used commonly. Okay. Now there's your little E. coli with your little Fimbriae. Okay, now when you look at somebody's urine, who has cystitis or urinary tract infection, what are you expecting to see?
Bacteria.
Only if you're really good.
Dark and cloudy.
Okay, you're expecting to see dark, cloudy, smelly urine, okay? Because remember, urine is a great bacterial culture, okay? And oftentimes people get into problems when they're dehydrated and their urine is more concentrated and they're not going to the bathroom as much. So you are expecting to see dark, cloudy, smelly urine. If they don't have dark, cloudy, smelly urine, does that mean they don't have a urinary tract infection?
Not necessarily.
Not necessarily. Okay, so what is it that you look for when you're looking through a microscope at urine? Blood. Oh, though sometimes you do see blood. White blood cells. Should there be white blood cells in the urine? Typically there should not be. Okay. Remember, if you see blood in the urine, it's either because the glomerulus has been torn, okay, way up in the nephron, or something is scraping in the tract, like a stone, or in some cases you can have hemorrhage with certain types of E. coli infections. That's called hemorrhagic cystitis, and it usually is quite impressive. But white blood cells, they crawl into the urinary tract, okay, and they will do that in response to inflammation, okay, in response to infection. So you shouldn't see white blood cells in the urine. Okay, now, white blood cells are going to be present in the urethra, and they're going to be present on the perineum. So how do you try to differentiate between what got picked up on the way down and what's there in the bladder itself?
Stream catch.
Clean catch, okay, and a midstream clean catch, okay, and sometimes you have to kind of look at the whole clinical picture because clean catches are hard to do, okay, especially for pregnant women. You can reach all over everywhere. Okay, so you kind of got to look and see what it is that you've got. Now, what you should be seeing is multiple white blood cells per high-powered field, okay? And most GYN offices have machines that they can stick a sample in, and they don't have to actually look through a microscope, but you can look through a microscope and do the same thing, okay? That's what a white blood cell looks like, in case you forgot, okay? This is a white blood cell. Most of those are white blood cells, okay? If you see that in a urinalysis, that's way more than just a couple of white blood cells per high-powered field, right? Okay. This little thing here is actually a screwed-up red cell. The rest of that stuff is just debris, okay, in the urine. Another thing that you might see in the urine, but probably not, okay, are crystals. Okay. most of the time, urinary tract infections are caused by E. coli or some other gut gram-negative bacteria. There is one type of bacteria, though, that can cause urinary tract infections that are problematic, and that is Proteus. Proteus mirabilis. Proteus can ascend the tract. When you grow Proteus on a petri dish, it will travel. Okay, it will make rings around the colony. It will scoot. Okay? It's a motile bacteria. Okay? And it can motile itself right up the tract. The other thing that Proteus can do is it can cause kidney stone formation. It can cause crystal formation that leads to kidney stones. Okay. Now, crystals are hard on the tract, okay, and crystals are one thing that can cause the tract to bleed. Now, what these are red blood cells, and it just depends on how the thing has been processed and stained. Most of these have not been stained. Here's some other crystals and junk. That's a more typical looking white blood cell. Now these are more typical of what you would see if you put urine on a slide with no stain. Okay. Okay, what is that? Is that a white blood cell? No, what is it? That's an epithelial cell, and we're going to talk more about epithelial cells when we talk about vaginitis. But remember, you can see epithelial cells sometimes in the urine. Okay, most of these are red blood cells. You can see crenated red blood cells over here. This is a white blood cell. Okay. Again, you would not expect to see a bunch of blood in the urine for a urinary tract infection unless you have damage to the tract or unless you have hemorrhagic cystitis. Okay? So in other words, if you're seeing blood in there, you may have a more complicated problem than just plain old garden variety, simple cystitis. Okay? What's this? That's yeast. Okay? Can you get yeast up into the bladder? Yeah, usually it's not very happy there. Okay? Can you get yeast in the urethra? Yes. Okay, and yeast in the urethra can imitate cystitis. Yeast infection or any other kind of vaginitis can also mimic cystitis.
If you had that and gave them an antibiotic, it would just make it worse, right?
Right. Okay, so you would want to be sure, you know, that in a situation like that, you would want a culture. Okay, that's a white blood cell. That's a white blood cell. That's a white blood cell. Okay, now, what sort of preventative things do you do to, do you advise, what sort of patient education, okay, do you advise people to minimize the chance of having urinary tract infections?
Pee after sex.
Huh?
Pee after sex.
Pee after sex. Okay, what else?
Decrease sugar and simple carbohydrates.
Okay, decrease sugar and simple carbohydrates.
Lots of hydration. Okay, both with stones and with urinary tract infections. Lots of hydration. What else?
Wipe front to back.
Wiping front to back. Okay. Okay, now what sort of things can be done besides antibiotics? What sort of ancillary alternative things can you suggest? Pardon?
As a sugar derivative, like let's say cranberries, active ingredient.
Okay.
Decrease the pH.
Which changes the pH. Cranberries also inhibit the ability of bacteria to attach to the wall. Okay. There's also, what is the name of that stuff? The tea. Uva ursi. Uva ursi tea is antibacterial, but it makes some people sick to their stomach.
I thought that was a diuretic.
Yeah, it's diuretic too. It's usually combined with diuretics.
Also probiotic strains that are for that genre.
Yep, probiotic strains. What else? I think over-the-counter sort of things that can be done. Azathioprine is a dye, okay, that actually acts as an anesthetic to the urinary tract. So sometimes it's given along with antibiotics. Now, azathioprine is not only an anesthetic, it is antibacterial. It's bacteriostatic. But it will stain everything. It will turn the urine bright yellow-orange. Okay. All right, now a couple of other things that you need to be aware of in the urinary tract world. Okay. Genital mycoplasmas. Okay. These are fairly weird little bacteria. Okay. Sometimes you see them referred to as ureaplasma. Genital mycoplasmas can cause cystitis in both men and women. They can infect babies in the birth tract, and they are considered to be usually sexually transmitted. So if you have somebody who is having repeated episodes of cystitis and you treat them, they get over it, they get it again, treatment over, get it again, okay, you may need to think about the partner. Okay, and then even weirder, maybe just for the sake of completeness, leptospirosis is a urinary tract bacteria. It is secreted in the urine of animals, which makes it a zoonosis. People pick it up either from contact with animals, their urine or their feces. Sometimes they pick it up from contaminated dirt. Now, leptospirosis is a spirochete. We're going to be talking about a spirochete down the road here with syphilis. Leptospirosis also causes a really wide variety of stuff. You may just have somebody with a urinary tract infection, or you may have somebody that's in the intensive care unit. Okay. Okay, now genitourinary infections also, remember, puerperal sepsis or endometritis, or childbed fever is a genital tract infection. Okay, how typically is puerperal sepsis transmitted? Pardon? Nosocomially. Okay, in other words, by something that is not clean enough. Okay, with somebody helping with the birth process. So, unsanitary delivery procedures. Remember, puerperal sepsis or puerperal fever is what was killing off the Austrian guy, the Viennese guy, Semmelweis. This is what was killing off Semmelweis's patients. Okay. One difference is that puerperal sepsis, instead of being caused by gram-negative organisms like you tend to expect in the urinary tract, it can be caused by your gram-negatives, but it's also more likely to be a strep or a staph, which are gram-positives, skin organisms. But it can also be Clostridia or any of the other bacteria. Now, is endometritis always nosocomial? No, remember you've got a wide open tract there, okay, and your vagina has got its own colony of organisms. So just because somebody develops endometritis doesn't necessarily mean that somebody needs to get sued. So let's talk a minute about the normal physiology of the vagina, the normal sorts of things that you can see. Okay? What do you know about bacteria that live in the vagina? Okay, it changes depending on a person's hormonal status. Okay. In other words, little girls and postmenopausal women have a different microflora in their vagina than somebody during their reproductive years. Okay, what else? What sort of bacteria predominate? Lactobacillus. Okay, lactobacilli predominate in the vaginal tract. Okay. They not only produce lactic acid, but they also produce hydrogen peroxide. So lactobacilli help to keep other organisms that are, more pathogenic out of the way. One of the reasons to avoid douching is because douching can upset the environment and kill off your lactobacilli, and then you wouldn't have their protecting effect against other sorts of bacteria. Now, sexual intercourse typically raises the vaginal pH, okay, or introduction of semen rather, raises the vaginal pH for 6 to 8 hours. This can help to enhance the transmission of sexually transmitted organisms. Presence of foreign bodies, okay, diaphragms, tampons, small objects. Okay, this disrupts the ability of the vagina to do its natural cleansing. Now, there are a bunch of different organisms besides lactobacilli. You have Gardnerella and a bunch of other organisms that you would typically find. Now, sexually transmitted diseases are organisms that, for the most part, you find just in the genitourinary tract, and most of them are either fairly fragile or they don't live outside of body cells at all, like chlamydia, okay, and they are usually transmitted by intercourse. Okay. Now, this is a fairly old slide. However, I think it's illustrative. Rates of contracting various STDs after one heterosexual unprotected intercourse. Notice with chlamydia in women, 50% for gonorrhea in women, 30% for herpes and for syphilis. This is one thing that is good to show teenagers, because it helps to support the idea that if you don't know your partner and you don't know the STD status of your partner, you are playing Russian roulette. Okay? You have a 1 in 3 to a 1 in 2 chance of picking up a sexually transmitted disease if that individual has one. Now, you will see different statistics in different books about which is the most prevalent STD. There are some books that will put chlamydia as the most prevalent. Some will put genital herpes as the most prevalent STD. There are some things up on the website about the different, like for example, syphilis is kind of coming back, and the incidence of syphilis is increasing. Okay, vaginitis. What does vaginitis mean? Any inflammation of the vagina, usually from an infection or from an imbalance of something somehow. Now, by the way, how are you guys doing on needing a break? Because this is probably a good place to take a break if you need one. Are we good? All right. Okay, vaginitis. What are the symptoms of vaginitis?
Itching, burning, redness, discharge.
Okay, discharge is probably the number one thing, and we're going to be paying a lot of attention here to discharge. But also you can have itching, redness, dyspareunia, okay, dysuria. Okay. Now, is a vaginal discharge normal? Okay, the answer is maybe. Okay, the vaginal epithelium does cleanse itself by producing fluids. There are times that those secretions are thicker, okay, and sometimes it produces a whitish sort of discharge that's called leukorrhea. Okay, that may or may not be indication of an infection depending on what else you've got going on, okay, around it. Typically, leukorrhea is not doesn't cause dysuria, dyspareunia, itching, and all of that kind of stuff. Okay. Okay, so when we look at the different types of vaginitis, the symptoms are all pretty similar. So telling the difference between the different types of vaginitis comes down to two things. Looking at the discharge, and what we're going to see is that the discharge sometimes doesn't tell you much. Okay? And it comes down to some of the simple kind of tests that you can do with a wet prep. Okay? So the first one we're going to talk about here is yeast vaginitis. Most of the time, the yeast involved is Candida, but not always. I'm not sure, for example, that that's Candida. It doesn't look quite right to me. Okay. Candidiasis, or Candida albicans, is usually the most common cause of yeast vaginitis, okay, but not always. Candidiasis can also cause infection of the skin and can cause infection of other mucous membranes, okay, including in the mouth and the rectum. The discharge that you see with a yeast infection typically is white and clumpy. Okay? It tends to be cottage cheesy looking. But as we're going to see, all of these have a whitish, creamy-ish appearance. So there's going to be times when you're going, well, that looks just like cottage cheese. It must be yeast. Other times you're going to be looking at it and go, well, it looks like white cream. Okay? So that would be an absolutely raging case of yeast vaginitis. Okay, that's the vaginal mucosa there. See how it's kind of got a patchy look? See also how underneath those white patches you've got a very red mucosa. Okay, that even looks like it hurts. what would you see if you looked under a microscope? You might see nothing, okay? Or you might see the little hyphae, the little yeast hyphae. Okay? Those are yeast hyphae on a wet prep. Now here you are seeing both squamous epithelial cells and yeast. Okay? The dark ones are yeast. Now when you do a wet prep, how do you do a wet prep? Okay, you swab the inside of the vagina, and then what do you do?
Smear it on a slide.
Smear it on a slide, and what do you do?
Add saline or something.
Okay, usually to get it to smear around so that it's not just clumps there, you add a drop of saline. Okay, then what do you do?
Drop it over it.
No, you don't drop a cover on it because you're going to be dropping other stuff on it in a minute. Okay, so the first thing you do is look at it. Okay, and what are you looking for? Okay, you're looking for anything that's not supposed to be there. You're looking for a ton of squamous epithelial cells and what they look like. You're looking for a ton of yeast. Okay, you're looking for white blood cells. Might you see anything? You might not. Okay, so what's the next thing that you do? Okay, you drop what on it?
KOH.
KOH, which stands for potassium hydroxide. Now when you drop KOH on it, two things will happen. Okay? Any cells that are there will lyse. Okay? So you have to look first before you put anything on there, because if there are cells there, after you put the KOH on there, they're going to be gone. So KOH will lyse cells. It will also turn yeast hyphae black. Okay. So if there are yeast hyphae there, they're going to be easier to see once you put the KOH on there. Now, some bacterial infections produce amines. Do you know what amines are? They're smelly little critters similar to ammonia or to dead fish. So when you put your KOH on there, you should also smell, okay, and then look. Okay, so you look, you put the KOH on, you smell, and then you look again. If it smells like dead fish, okay, that's called a positive whiff test. Okay, in other words, it stinks. Candida typically does not have a positive whiff test. But with Candida, after you put the potassium hydroxide on there, you should be able to see the yeast hyphae. They should stain black. Now, are women the only ones who get Candida infections? No. Okay, men can get Candida infections, and occasionally you will have a situation where you want to treat the partner, okay, as well as the lady. If you have somebody that has repeated yeast infections, what do you need to look for? Diabetes, HIV, and what's the third one? Come on, midwives. Pregnant, okay? Pregnant, diabetes, or HIV. Now, before you go scaring your person into the next century by suggesting they might have HIV or leukemia or some other immunocompromised state, bear in mind that there are all different kinds of yeasts, okay? And Candida albicans is not the only Candida out there either. So if she's having repeated yeast infections with one type of antifungal, you may just want to simply switch to a different type of antifungal. Okay. So that's penile candiditis. What's that?
For a baby.
That is diaper rash. Okay. Does diaper rash always occur just in babies? Okay, no, sometimes it can occur in under the breasts or in other areas that are dark and damp. Okay, so that also is candida. What is this? That's thrush. Okay, remember candida can infect other mucous membranes. Sometimes infants will pick up candida through the birth canal, okay, and they will develop thrush. Now, what do you do about it? Okay, you can use gentian violet.
Is that in, like, in your vagina? Yeah.
They used to, back before they had the azole antibiotics, they would actually paint the vagina with gentian violet. Now, if you think that azo is a problem with staining things, gentian violet is a mess, okay? It will stain things, okay? It is also a dye, okay? But it kills candida. What else can you do? Okay, you can do an antifungal like diflucan, or any of the azoles like miconazole, and there's about 18 dozen different ones of them out there. Okay. Now azoles, all of them except for diflucan are given topically. Okay, all of them except for diflucan are used topically. Okay, diflucan can be used topically and it can also be used orally. Now, there are other big guns antifungals, like amphotericin B, but this would be like shooting a gnat with an elephant gun. And amphotericin also tends to cause liver damage. Now, I have heard of people doing all kinds of things with yeast infections. Okay, I've heard of people increasing their yogurt intake or their buttermilk intake, all of which makes a lot of sense. Okay, I've heard of people using yogurt and buttermilk and things like that in their vagina. If that makes them feel better, good. Okay, I've heard of people using things like garlic, olive oil, things like that, okay, which probably makes them smell like a salad. Okay, what do you have to be careful of if you're using garlic in the vagina? It can burn the absolute stuffing. It will burn even skin, and normal vaginal mucosa. Okay, so you need to be careful with that, what you tell people to do. Okay, they may not appreciate you. Okay, that is a photo of a raging yeast infection. Okay, and in this one, it looks like it not only involves the vagina, it looks like it involves the vulva outside as well. Here is again what you would see on a slide. Here you can see most of this stuff is just bubbles on the slide. These are squamous cells, okay, and these are your little yeasts. Okay, this is what you might see after potassium hydroxide, maybe. Okay, black. Okay, bacterial vaginosis. Bacterial vaginosis, they argue about what actually causes it. Okay. And they go back and forth about whether it's an infection and whether it's a sexually transmitted infection or whether it's just an inflammation and an imbalance of the vaginal microflora. The current thinking, as near as I can tell, is that they think that it is an overgrowth of bacteria that you might find in the vagina normally, which means that something has disrupted the microclimate there in the vagina. Okay. Now, I have heard anecdotal stories that people in unhappy sexual relationships or people with new partners, where there might be some stress and anxiety there going on, have developed bacterial vaginosis. Okay. Sometimes with sexual relationships that are not as relaxed as they should be, there can be micro-tearing, there can be not as much lubrication in the vaginal milieu. Whether that has something to do with the development of bacterial vaginosis, who knows, okay? And again, there's different opinions about whether it's sexually transmitted or not, okay? If you have it in response to sex, okay, but if the bacteria are there in the first place, okay, you see how this kind of thing goes? With bacterial vaginosis, you tend to have a grayish, whitish discharge. And it tends to stink, particularly after sex. Sometimes with bacterial vaginosis, you don't even need a whiff test. It just stinks straight up. So the first diagnostic indicator with bacterial vaginosis is a positive whiff test. The second indicator is the presence of clue cells when you look on your slide. Now, a clue cell is a simple squamous vaginal epithelial cell that is absolutely covered in bacteria. Covered in bacteria. Okay. So you see how here you can just kind of see some bacteria around there, but you still see the cell and the cell margins very clearly. Notice how here you've got so much bacteria glommed on there that the border is kind of obscured a little bit. Okay. It looks like it's been powdered or peppered or something. So, positive whiff test. Okay, I'm telling you, if you've got something that close to your nose, it's not a positive whiff test. Okay. Again, positive whiff is because of the amines, okay, that are released when you put the potassium hydroxide on there. Okay. Creamy, grayish looking discharge. But again, just from looking at that, you wouldn't know exactly what you were looking at. But see how red? And again, this is a picture of the cervix. See how reddish and just kind of creamy grayish here. When you see a cervix that looks like that, you don't know whether that's gonorrhea, chlamydia, bacterial vaginosis, what, okay? So again, this is an unstained clue cell. See how it looks kind of shaggy around the edges? Okay, again, clue cells. Here, this is your squamous cell, and that's all your bacteria glommed on there. Okay, is that a clue cell? Yeah, it probably is, but even up here, I have to look at it close. The best way is looking at this one, okay, which doesn't seem to have a lot of bacteria glommed on it. This one does. Notice how the border there looks kind of fuzzy. Is that a clue cell? No. Okay, let's take a break because gonorrhea is going to take a while. Oh, wait. How do you treat bacterial vaginosis? Flagyl, metronidazole. What do you have to remember to tell people? No alcohol. Very good. Okay, take a break and we will come back. All right. Gonorrhea. Gonorrhea is a very big deal. Okay. It is a gram-negative diplococcus, sometimes called the gonococcus. can cause devastating consequences in women and in children. In men, it can be transmitted to other places besides the genital tract as well. Now, what we're showing here on this particular slide is gram-negative diplococci, two little browned bacteria that are joined together that are infecting squamous cells, and they're under a electron microscope. Some of these are capsulated, some of these are ones that can use their fimbriae to glom onto the wall. And we include gonorrhea here because it produces a vaginal discharge. Now, this is not an insignificant point, what I'm going to say here. The gonococcus does not typically infect the vaginal mucosa. It infects the cervix. So, does gonorrhea cause a vaginitis? Typically, it does not. It causes a cervicitis. Can you tell the difference? A lot of times you can't, okay, because what you got is a creamy discharge that might be yellowish or it might not. Okay? So here's the vaginal discharge of the introitus. Here is the vaginal discharge from the urethra in men. Okay. It can also infect the urethra in women. It can infect the rectum in both men and women. It can infect the throat in both men and women. It can travel up the genital tract out into the pelvic cavity and cause pelvic inflammatory disease and or salpingitis, which is inflammation of the tubes. Inflammation of the tubes causes scarring in the tubes. Pelvic inflammatory disease is going to cause pelvic pain and abdominal pain. You can have the gonorrhea growing all over inside the abdominal cavity, including up behind the liver, which is called Fitzhugh's syndrome. Gonorrhea can also make its way into the blood and start to circulate in the blood. It can infect joints, okay, and it can infect some of the other body organs as well. Okay. In addition to infecting the genital tract, it can infect the Bartholin's glands, which I think I have a picture of here somewhere or the other. And it can infect the eyes of the neonate and the rest of the neonate as well as it descends through the birth canal. Elizabeth Blackwell was the first woman to qualify as an MD in the United States. After she graduated from medical school, all doors shut to her, and so she went to Europe for some of her postgraduate training, and she went to I forget what you call it, in Paris. It was basically the hospital that took care of indigent OB cases in Paris. And this was in the pre-antibiotic era. There was a lot of gonorrhea because these were poor women and oftentimes they were street women. And a lot of babies developed gonococcal conjunctivitis neonatorum. And they didn't have anything that they could really do about it at the time, except for they would irrigate the eyes. Sometimes they would irrigate the eyes with a silver nitrate solution, but I think in her day they were actually just simply irrigating the eyes. So she wanted to go to a lecture one morning and she was in a hurry and she did the syringe too hard, okay, in irrigating a newborn's eye, and the fluid from the syringe hit the newborn's eye and then bounced into her eye. And she developed gonococcal ophthalmitis, nearly lost her life, lost her eye, lost the sight in that eye, and that ruined the chances of becoming a surgeon, because you have to have depth perception from two eyes to be able to be a good surgeon. So it's not an insignificant disease. There were multiple cases back in the Victorian era in particular where the idea was that guys could do anything they wanted to do and women were supposed to be these nice, pure, innocent little things. And so the guys would go out and do whatever, and then they would marry this innocent little thing. And do you remember what the incidence of transmission of gonorrhea is to women with one heterosexual intercourse? So these girls were developing gonorrhea and then were dying from it, okay, having never had contact with anybody but their husband. So it's a big deal. Now, gonorrhea is not something that guys are going to miss. Okay, it causes a painful urethritis. Women can miss it because the cervicitis is not painful. Okay, and depending on how much discharge that they have, they may or may not notice that they're having extra, leukorrhea kind of discharge. Now, what women will notice, though, is an infected Bartholin's gland cyst or an infected Bartholin's gland. Okay? Now, not all Bartholin cysts are caused by gonorrhea, but enough of them are that when you have an infected Bartholin's gland or when you have a Bartholin's gland cyst, you must rule out gonorrhea. Now, typically what a Bartholin cyst will do is it will develop an abscess with a fairly firm wall around it. Okay? And the tissue swelling and so forth do not allow the infection in here to drain out through the Bartholin's gland duct. So what they do is an IND, which stands for incision and drainage. They cut this thing and allow all the pus and junk in it to spew out. Okay, they clean it out, and then they let that heal from the inside out.
I have a question, Dr.
Yes.
Scott. We had a patient come in this week I was doing her history, and she said she's had 2 marsupilizations of her Bartholin's gland.
Why they call that a marsupilization, I'm not sure. I'll have to go look in my surgery book. But it basically is where you cut into the pouch there and release the stuff. Now, she may have narrow ducts, or, gonorrhea is by far not the only thing that causes Bartholin gland cysts. So
She said it's just something she lives with. It's like one of her Bartholin's gland is permanently enlarged, like a marble. So it was interesting. I've never heard of that before.
usually not comfortable. These women are not comfortable when they do this, when this happens. All right. It's not something that you're going to miss if it gets in the eye either. Okay, and it is a cause of blindness in newborns. We used to put silver nitrate in all of the newborns' eyes, and that was by law in most states. Silver nitrate is fairly irritating itself, and so the babies ended up with red eyes. They've now gone to putting erythromycin ointment in the eyes. I think in some states parents can refuse it, but it doesn't hurt anything. Most of the time, especially in hospitals where you may or may not know your patients very well, they tend to try to put a lot of heat on on parents to just go ahead and let them stick the erythromycin in their eyes. Sometimes they don't even ask. Okay, but that's the reason for that. Gonorrhea can also affect the joints, and it is one of the leading causes of septic or or bacterial arthritis, especially that occurs in just one joint. Typically, if you have like osteoarthritis or rheumatoid arthritis or gout, you usually have more than one joint involved. Okay, and in men and women, it can affect the liver and the heart as well. More typically, the liver is affected in women because of its position within the abdominal pelvic cavity. Pelvic inflammatory disease, I'm not sure whether you can see. Yeah, you can see. All of this is where about pink, okay? That's where you have pus, okay, from the gonorrhea infection. Now remember, the peritoneum is bitchy, okay? The peritoneum does not like inflammation. So you're going to have pain, you're going to have scarring. One of the things that we talk about when we get to an acute abdomen, one of the things that can mimic an acute abdomen is pelvic inflammatory disease. All forms of pelvic inflammatory disease are sexually transmitted. Now, there is some discussion about how the bacteria get there. And I was laughing at one of my violets yesterday because they had never actually realized that the female genital tract is an open passageway to the between the outside and between the peritoneal cavity. Okay, so the infection can simply ascend from the cervix up out through the tubes, okay, infecting the tubes and scarring the tubes on the way. However, it is possible that the gonococcus can also spread through the lymph ducts and through the veins as well. Okay, and that's probably how it gets into the circulation to infect the joints or infect the heart. Okay, are you going to have a positive whiff test with vaginal discharge from gonorrhea? No. Are you going to have dark staining hyphae with the KOH? No. Okay. So if you have creamy discharge, no whiff test, and no hyphae, you probably need to be doing a test for gonorrhea and for chlamydia. Okay. Everything you say about gonorrhea almost goes for chlamydia as well, except for chlamydia tends to not be as noticeable in men. Okay. So chlamydia also causes cervicitis. Chlamydia also can cause pelvic inflammatory disease. It is often missed. It can scar the tubes terribly. It doesn't typically spread to cause arthritis and carditis. It doesn't cause ophthalmitis. Okay. But it's very easily spread silently. Okay. So typically when you have a creamy cervicitis, they will test for both gonorrhea and chlamydia at the same time. All right, trichomonas. Trichomonas is a different critter, which looks like that. Okay. It's like something that you would find on the Muppets. It's called a trichomonad. It is a protozoal. Okay. It is sexually transmitted. It doesn't live outside the genital tract. Now, trichomoniasis can be diagnosed a couple of different ways, some better than others. In the past, they occasionally would diagnose trichomoniasis based on a pap smear. And then they realized that they were getting all of these false positives, okay? Because they were looking at cellular debris on the pap smear and calling it a trichomonad. Okay, and that's not accurate. So there were people who were being diagnosed with trichomoniasis who probably didn't have trichomonas. Okay? And considering the fact that trichomonas is supposed to be sexually transmitted, okay, then you had people, looking at their partner going, okay, what have you been doing? Okay? Or you had weird situations like nuns, for example, who were being diagnosed with trichomonas. Now, is it possible for nuns to have trichomonas? Yeah, some people weren't exactly saints before they got themselves to a monastery or whatever, okay? Get me to a nunnery, okay? But that being said, there was this weird sort of two different paths, and there was argument about whether it was sexually transmitted or not. What they have decided is that it is, okay? Now, in my mind, I have a slight question remaining, okay? Things like hot tubs, okay, or some of these damp sort of places that are open to secretions and that may not be properly chlorinated or properly cleaned, okay? I just have a caveat in the back of my mind yet about trichomonas. But the current thinking is that it is sexually transmitted. Now, it typically doesn't cause symptoms. It typically doesn't cause symptoms in men, and it typically doesn't last very long in men. It's kind of self-limited. However, they usually will treat both partners, okay, because a woman can be reinfected from a male partner. Now, the symptoms are a grayish or greenish discharge. Okay? Now, if whitish, creamish, grayish, greenish doesn't really do much for you, which doesn't do much for me, that's why you have the other things that you're supposed to be looking at. You can't necessarily diagnose vaginitis just by looking at the discharge that you see. With trichomoniasis, you're not only seeing cervical irritation, you're seeing vaginal irritation, and the vaginal wall is usually red as well. Okay. Trichomonas also stinks. Okay. You're going to have a positive whiff test with trichomonas. When you look at the organism under the microscope, sometimes you can see the little organism, sometimes you will just see something moving or scooting around. Okay. If you have a positive whiff test but no clue cells, you tend to assume that you have trichomonas. And the nice thing is, if you're wrong, the treatment for trichomonas and the treatment for bacterial vaginosis are the same. Okay, you both of them are treated with flagyl. So, does that look green to you?
No.
Doesn't look green to me either.
There's a green tint to it.
Okay. Greenish, I guess, for imagination.
That's great.
Okay. Strawberry red vagina.
Looks like there's little lesions on it.
This is trichomonas. But again, that looks like there's erosions there. And that's your trichomonad. You see how you sort of have a strawberry looking cervix. And here you have your cells. Your trichomonads are going to be this size. How do you know that that's a trichomonad? How do you know that that's a trichomonad? You should be able to see them moving around. Okay, what is that? That is a worm egg. Okay, and what this is fecal material. Is it unheard of that a person might have worms or other types of parasites and have them show up in the vaginal arena? No. Okay. Okay, what is this? Can you see it well enough? Let me give you a hint.
Is it the tail?
Yeah. There's a tail here. There's a tail here.
Is it sperm?
There's a tail here. Yep. Sperm. And remember, when you are looking at wet preps from the vaginal mucosa, you may also see sperm. And what's that? Huh?
This is pollen.
It's pollen.
Oh my god, it is.
Okay, it's pollen. Okay. It looks like a little sand spur. It's pollen. Okay, is it unheard of that you might have pollen from vaginal secretions? No. Okay.
It's not.
Okay, again, that yeast. I don't remember why it's in here. Wrong place. Okay. On to herpes. Remember, there are two types of herpes, herpes simplex 1 and herpes simplex 2. They are two varieties of a similar virus. Do they care about where they grow? No. Okay, so you can have herpes simplex 1 in the genital area, and you can have herpes simplex 2 in the oral area. All herpes viruses are latent viruses, which means that they hide out in the nerves, particularly in the sensory nerves, okay, and then they can recur. So you don't ever get rid of the virus, okay, you just suppress outbreaks of the virus. Okay. Now, anything, or in some cases, people will say nothing, can cause an outbreak or a recrudescence of either cold sores or the herpes 2 virus. It's thought that anything that makes the immune system a little wonky will allow the herpes virus to recur. Okay? Now, obviously, people shed the virus while the cold sore or while the genital herpes lesions are there. They shed virus. The downside is that they also potentially can shed virus even with no lesions present. Okay, and this contributes to genital herpes being transmitted with nobody being aware that it was transmitted, okay, or nobody being aware that they picked it up. Okay, so along with chlamydia, some authorities will say that genital herpes is the most prevalent sexually transmitted disease in the population. Now, in addition to having these blister-like lesions that are very painful, genital herpes is a problem in the context of childbirth because the baby can pick up the virus on the way through the birth canal. The baby is relatively immunosuppressed in the sense that its immune system is not mature yet. Okay? It's just coming online. So any viral infections that the baby picks up can be catastrophic. Okay, so for example, with herpes, you can have herpes encephalitis, you can have herpes pneumonia. Okay, it can be a really, really bad thing with babies. Now, 100 years ago when dinosaurs walked the earth and I was in school, if a person had a history of genital herpes, they had a C-section, period, straight out. Okay, they didn't even bother with the genital tract. Nowadays, they're a little bit more likely to flex that, okay? They're still not gonna let somebody deliver vaginally that has active herpes lesions, okay? But if they do not have active lesions, sometimes they are allowed to deliver vaginally. Part of the difference is acyclovir, okay? They can use acyclovir to shorten recurrences to diminish the amount of virus that is being shed. So some physicians will allow people to deliver vaginally, okay, and they may use acyclovir in conjunction there with that. Okay. So herpes simplex life cycle, your sensory nerves, okay, it hides out in the cell body of those sensory nerves, and then it can be reactivated. And then you have your lesions out here on the skin, blister-like lesions on the skin. Common sites for herpes blisters, okay, the thighs, okay, the perineum, anywhere on the perineum, the vulva. You can have herpetic lesions of the vagina, which may produce a vaginal discharge. Okay. The penis, okay, and they tend to look a lot like chickenpox lesions in some respects, okay, and then they tend to crust over as they are getting over. Okay, and same sort of thing with cold sores on the lips. Okay, here, this picture's probably hard for you to see, but right here and right here you have blisters. Let's put a picture. That, okay, again, I'm sorry this picture is so small, but you see all of this right here? All this right here? Okay, that's part of the vulva. Okay, so that's a horrific outbreak. You can have lesions not only on the external lips, but you can have lesions on the internal lips. Okay.
Are those the same things as canker sores?
No, canker sores are not the same as cold sores, but they can be mistaken, okay, for the same thing. It's not the only virus that can cause those little ulcerated looking areas. Okay. Canker sores typically present as ulcers, not blisters. Okay. These kind of things present as blisters, but then may develop into an ulcer and then may crust. Okay. That hurts just looking at it. Okay. Okay, again, you've got lesions here. Okay. These are anal lesions. Lip lesions. Eye lesions. Now, anything with the eye, herpes, chickenpox, any of the herpetic infections that involve the eye, they worry about. Okay, they can cause blindness. This is corner of the mouth. Okay, herpetic whitlow. A herpetic whitlow is herpes lesions on the fingers.
A whitlow.
Yeah, whitlow. Now, I had a friend who worked in a dermatologist's office, and she used to tell her teenage girls, keep his hands out of your pants. Okay? And in her world, she was referring primarily to human papillomavirus, but the same goes for herpes simplex as well. Okay. And have herpetic lesions on the hands. Okay, again, herpetic lesions on the shaft of the penis. Okay, around the introitus. Okay, penis. Okay, human papillomavirus. We're not going to spend as much time on human papillomavirus today because we're going to talk about it a little bit more in conjunction with cervical cancer. Basically, there are 48 bazillion human papillomaviruses. There are also 100 million bazillion papillomaviruses that affect other animals, okay, sea turtles, manatees, on and on and on. Okay. Papillomaviruses are very common viruses. Okay. And they cause various types of warts. Okay. The $10 word for wart is verruca. Okay. And the wart virus is also a latent virus that causes abnormal growth in tissue. The virus actually can insert itself into the genome of those tissue cells and can cause abnormal growth. Now, there are many different warts viruses. The common wart viruses are the ones that you tend to see on kids or people who are immunocompromised for whatever reason. Okay? And most of the time they go away on their own. They can be encouraged to go away various ways, putting salicylic acid on them, which is what compound W is. It eats through the abnormal growth, and then it eats down into where the virus is hiding and eats it, and then we're done. Okay. The immune system also will clear human papillomavirus sometimes. Okay. In fact, I have seen some books which will say that it clears human papillomavirus most of the time. Okay. The problem comes with the human papillomavirus subtypes that have a predilection for the genital tract. The subtypes that have a predilection for the genital tract. Both of them can cause lesions of the genital tract that can lead to cancer, okay, vulvar cancer and cervical cancer. Personally, in my mind, I am a little curious about skin cancers in general and whether papillomavirus is involved in skin cancers or not. Okay? There's no indication out there yet that they are, but I just wonder about it. Okay. So, this is genital warts caused by human papillomavirus. Genital warts around the anus caused by human papillomavirus. This is a penis, if you can't tell, because it's got a bunch of warts all over it. Okay. Warts in the perineum. Warts on the inner labia. This is the female introitus somehow. This is warts along the head of the penis. And warts in the groin area. Now, I have to put on the board a botanical treatment for genital warts. The FDA's just approved, it's 2008, a botanical drug product for genital warts. Some of the things that have been used in the past for genital warts are not only expensive, but they are not to be used during pregnancy. Okay, so this might be something you might be interested in taking a look at. Sure that this one is recommended or is allowed during pregnancy either, but it is a new treatment for genital warts. Not usually. Okay, cervical lesions are not usually painful. Okay, now, some of the rest of these diseases, except for syphilis, are more unusual. Why do we even talk about them? Okay, well, one reason that we talk about them is that some of them are very common in the Caribbean, okay, and this is Florida. The other is you are midwives, and so you are supposed to be at least noddingly familiar with all things genital. Okay, so chancroid is a sexually transmitted disease that's caused by the Haemophilus bacteria, Haemophilus ducreyi. It produces a chancre. Now, do not tell me that syphilis produces a chancre, and do not tell me that chancroid produces a chancre. Tell me that syphilis produces a hard, painless chancre, and that chancroid produces a soft, painful chancre. Now, this is one thing that if I could get you into an STD clinic, you would never forget. Because with syphilis, you know, these guys will come in with chancres on their penis and it looks like a canker sore. And you're thinking, man, that has got to hurt, okay? And you can take it with a gloved hand and poke all over that chancre and it doesn't hurt, okay? They don't jump out of their skin, okay? That's different with chancroid. You have chancres, but they're soft to palpation and they tend to hurt. Now, chancroid also tends to produce swollen lymph nodes in the groin. That's what the bacteria looks like with a stain. Okay, that's what the chancre looks like. Okay. The pictures that I see of chancroid, I've never seen chancroid. I have seen syphilis chancres. The pictures that I see of chancroid look a little gushier. Okay? They look a little gushier. All right, those are chancroid lesions on the introitus. Again, sometimes these can drain a bit. Chancroid lesions. Now, again, you're going to see a lot of dark skin in these pictures. Why?
Caribbean.
Huh?
You said it was.
Caribbean, yeah. Okay, a lot of these are endemic in the Caribbean, and many people, if not most people in the Caribbean, are dark skinned. Okay, here you're seeing not only chancres on the penis, but you're seeing lesions in the area where you have the lymph nodes.
What's the treatment for that?
The treatment is antibiotics. Okay. Let me make sure I'm telling you the right one. I think it's doxycycline.
The book says Zithromax or Rocephin.
Yeah, this one says erythromycin, tetracycline, sulfa drugs. I have never heard that chancroid is hard to treat. Okay, it's susceptible to a lot of stuff. Okay. The STD treatment thing that I'm going to put on the board. Let's see what it says. It has erythromycin, azithromycin, and Rocephin or Ceftrax. And so I don't forget it, let me give this to Brooke to stick it up there. It has all the different sexually transmitted diseases and what the recommended treatments are for them. Even though this one is from 1994, they haven't changed. Okay, the recommendations haven't changed yet. I keep looking. All right, granuloma inguinale. Granuloma inguinale is a different disease than chancroid, but it tends to look real similar. again, you have lesions that develop into granulomas or ulcerated looking areas. They are not called chancres, I'm not sure why. Granuloma inguinale can produce draining lesions from the lymph nodes in the area. Oh, wait a minute. That's lymphogranuloma. There's three of them that I tend to get mixed up. Okay. Chancroid, granuloma inguinale, and lymphogranuloma venereum. So when we show the pictures here, you're going to see why. They all tend to produce lesions that are ulcerated looking. All of them also tend to infect the adjacent lymph nodes. Okay? How are you going to know what it is that you're looking at? You're probably not. You're probably going to have to do a culture. All right, so granuloma inguinale.
So does this, so this one does or doesn't make lesions from that?
It does make lesions.
Oh.
Yeah, see, look. See, in the inguinal area. Now, remember, a granuloma is what happens with both syphilis and with tuberculosis. The macrophages are glomming in there and are trying to surround the area and wall it off. So this is granuloma inguinale. This is granuloma inguinale. This is granuloma inguinale. Okay. And you can have granulomas other places as well, depending on where the bacteria have landed. Okay, and again, antibiotics. Okay. Now, the third one here is chlamydia. Now, chlamydia can produce cervicitis. It can produce pelvic inflammatory disease. And it can produce lymphogranuloma inguinale. Okay. Chlamydia can produce cervicitis with a discharge. Looks just exactly like gonorrhea. It can produce pelvic inflammatory disease that looks like gonorrhea. It can produce lymphogranuloma venereum, which looks more like granuloma inguinale. Chancroid. Okay. Okay, so, oops. Lymphogranuloma venereum. Lymphogranuloma venereum. All right, now remember, the chlamydia organism can also cause trachoma of the eyes. Okay, and in some parts of the world, particularly the Nile Valley and some parts of South Asia, it is still a significant cause of blindness. Chlamydia can also be transmitted to the baby through the birth canal, and again, you have a similar sort of deal that you do with herpes, where the child is relatively immature immunologically, and so you can have chlamydia pneumonia, chlamydia encephalitis, okay, real bad stuff with the baby. So again, on here, what you are seeing is this trickly whitish discharge. Chlamydia, if it's possible, is even harder on the fallopian tubes than pelvic inflammatory disease is. It's estimated that one instance of chlamydia PID that is caught and treated properly will diminish a person's fertility by 25%. 2, 50%. 3 instances, 75%. Okay? And the reason why it diminishes fertility is because it scars the tubes. That prevents implantation and also increases the likelihood of ectopic pregnancy. Okay? And remember, chlamydia in women often has few to no symptoms. Okay? There are some gynecologists out there who test every single sexually active teenager for chlamydia, no matter what they came in for. Okay? Okay, now, you have a urethral discharge in men. Okay, notice that that's not as creamy looking as the gonococcal discharge. Okay, again, it can be a little harder to notice, but again, in men, it's usually more painful, so they tend to pick up on it. Okay. Again, your non-specific looking creamy white discharge. Now, with lymphogranuloma venereum, okay, you have the same organism, chlamydia. Same organism, Chlamydia trachomatis. But remember, different bacteria sometimes can have a different toolkit. Okay? And so they can cause a slightly different disease presentation. In this case, it causes lesions in the inguinal areas, and it can cause draining lesions of the lymph nodes, and I couldn't find a picture of that. So again, if you see something that looks like that, okay, culture. All right, let's go through pelvic inflammatory disease here quick because we have been talking about it, and then we'll have a break. Pelvic inflammatory disease is usually a consequence of cervicitis. The two that are most involved are the gonococcus and chlamydia. Typically, what you have is sometimes an inflamed uterus, but always inflamed tubes. Remember, the lumen of the tube is narrow, and any sort of inflammation is going to produce scarring that can scar the tube closed or can make the lumen very tiny. You can also have an inflamed ovary, and you can have pus and inflammation in and around the internal genitalia. So when you do a bimanual exam, cervical motion tenderness. You may or may not feel a lump, okay, depending on whether the adnexa is really swollen or not. Okay. I think I told you that in the past they used to stick a needle through the posterior fornix into the pouch of Douglas and aspirate. If they had cervical motion tenderness and pelvic pain and blood in the pouch of Douglas, they would assume that there was an ectopic pregnancy going on, or even a ruptured ectopic pregnancy. If they had cervical motion tenderness, pelvic pain, and pus in the pouch of Douglas, they would assume they had PID. Now, nobody has to stick a needle in the pouch anymore because they have ultrasounds. Okay, they can do it a little differently. Pelvic inflammatory disease. You can also have pus built up in and around. This is a picture that was done with a scope, okay, during laparoscopic surgery. And what it is showing you is collections of pus, okay, in some of the gutters and pouches and blind spots in the abdominal cavity. All right, next up is syphilis, and that's going to take a while, so let's go ahead and take a break. Come back in 5 minutes or so.
Give me a couple of.
You check as long as.
I got a clown. It makes you angry. Yeah, this little sucker does everything.
Right, I forgot.
You can go in there and extract Facebook. I would love photos of.
Yeah.
Drive over to what you
Keep going, girl.
They talk fast. It's less sensitive. Alright, syphilis. Syphilis is a corkscrew organism. The organism is Treponema pallidum. By the way, do you need to know the organism for gonorrhea? Yes, you do. It's Neisseria gonorrhea. Do you have to be able to spell it properly? Yes, you do. Do you need to know the organism for syphilis? Yes, you do. You need to be able to spell it properly. Yes, you do. I had one class that I threatened to get up in graduation and call them out if they couldn't spell gonorrhea properly. And so what they did is they got up in graduation and spelled it properly in front of everybody. But anyway, I am going to ask you, so do it. Just learn it. Okay. All right, Treponema pallidum. Okay, syphilis is sexually transmitted in the form that we see the most of it in the West. There are some related syphilis organisms that you see in South America and in the South Pacific that can be transmitted just by close contact. But Treponema, in the form that we see it, is sexually transmitted pretty much exclusively, except for that it can cross the placenta. Okay, this one can cross the placenta and cause congenital syphilis. Now, syphilis causes a painless, hard chancre. The chancre can appear on the external genitalia in women. It appears on the external genitalia in men, obviously. But it can also appear on the cervical mucosa or the vaginal mucosa. And if it's painless, is she going to know it's there? No. Okay. All right, so there's a chancre. Those are more typical looking chancres. Hard, painless. Okay, hard, painless. And there are multiple chancres. Now, those chancres are going to be teeming with the syphilis, the Treponema bacteria. Okay. So they, coming in contact with them, will transmit the disease. Also, there is a form of syphilis that looks very much like genital warts. Now, primary syphilis is the chancre formation, or more than one of them, formation. Secondary syphilis, which we're going to talk about in a minute, is usually a rash, but it can also produce this genital wart-looking stuff. And again, whatever body part it is that contacts those bacteria can develop a chancre. Usually sexually transmitted, it's going to be on the genitalia, but it doesn't necessarily have to be. Now, the chancre may be accompanied by a non-specific sort of febrile kind of illness, or it may be accompanied by nothing. Okay? And if it doesn't hurt, it's not painful. Okay? There are people who can and do continue to have sex while they have active chancres. Okay? And so it gets transmitted. After a number of weeks, 3-4 weeks, sometimes out to 6 weeks, the chancre eventually will go away. The immune system will work enough to get rid of that chancre. Okay? And people feel like, okay, I'm in the clear. What has actually happened, though, is that the bacteria now have escaped from that chancre and they are circulating throughout the rest of the body. Okay? This is called secondary syphilis. And again, secondary syphilis may have a non-specific sort of febrile illness kind of component to it, or they may simply break out in a rash. The rash is usually a macular rash or a maculopapular rash where you just basically have bumps, and sometimes you can feel the bumps a little bit. One thing that is unusual about a syphilis rash is that it will affect both the palms and the soles of the feet. Now, there's all kinds of things that cause rashes: measles, rubella, Rocky Mountain spotted fever, typhus, lots of different things cause rashes. But a syphilitic rash, secondary syphilis, will affect the palms and the soles, and that's unusual. Okay. So that's what a syphilitic rash looks like on the soles. This is what it looks like on the palms. Okay. This is what it looks like on the back. Now, typically, secondary syphilis also will clear in weeks to a month or so. Sometimes the body will completely clobber it at that point, but usually it simply goes underground. Usually it simply goes underground. When a person has no visible symptoms of syphilis at all, it's called latent syphilis. And in this case, what may be going on in the tissues is called gumma formation. A gumma is similar to a granuloma. It is an attempt by the immune system to wall off the area where that organism is. The syphilitic organism will destroy tissue, and the gummas themselves also cause damage to tissue. So you can have syphilitic gummas in any body tissue: brain, kidneys, bones. Okay. Archaeologists, for example, can tell whether somebody had tertiary syphilis because there will be gumma formation in their bones. Okay. Now, tertiary syphilis is when you start having symptoms then again, and tertiary syphilis symptoms will reflect where the gummas happen to be. Now, syphilis has a predilection for the nervous system, the brain, and the rest of the nervous system. So often, tertiary syphilis has neurological consequences: personality changes, dementia, tabes dorsalis, where they lose their coordination, okay, these kinds of things. Now, all three stages of syphilis can be cured by penicillin, but tissue damage will not be repaired. So if you wait until a person has tertiary syphilis before you treat it, the damage is probably not going to go away. Okay? If you wait until they have dementia before you treat it with penicillin, you may stop the process, but you're not going to fix their dementia. Penicillin is still the drug of choice for syphilis across all applications. It still works. Now, to minimize the chance that a person will be inadequately treated for syphilis, what they do is give a big honkin' dose of syphilis all in one shot. Okay? And they'll give 2 or 3 cc's in one shot in STD clinics. It's like they come in with a chancre, they get their huge, big old penicillin shot, and then when they walk out the door, they don't have to worry whether this person is going to come back to complete the treatment. Okay. Most public health departments will try to get a list of sexual contacts and then track them down and treat them as well. They try to do that with gonorrhea and chlamydia as well. Okay, but particularly with syphilis. Okay, now, syphilis is making a comeback in gay men. Okay? It's always been highly associated with HIV infection. In fact, they tend to help each other infect the individual. Syphilis and HIV tend to cooperate in helping to produce infection. And it's on the increase again in gay men again. Now, syphilis is a huge public health problem because it can cross the placenta and it can cause fetal death outright. Okay, it's one of the things that can cause intrauterine death. depending on what stage the baby is in, what stage of development the baby is in, just about any tissue in that baby can be infected by syphilis and damaged. Okay, so you could have a spectrum from, you know, funky looking teeth, which I'm going to show you in a minute, right on through to major mental retardation, heart defects, skeletal defects. Okay, so there's a range.
How long does it take between an infection and crossing the placenta?
I don't know. Okay, crossing the placenta is associated with secondary syphilis. Okay, so if somebody has a chancre, you do have a little bit of time to go ahead and stop it. Okay, one of the things that you can see with congenital syphilis is called Hutchinson's teeth. These are Hutchinson's teeth. Okay. The person didn't take a file and file on their teeth. That's the way that their teeth grew. Okay. And that's a consequence of syphilis. This is also a picture of Hutchinson's teeth.
So that would be the fetus?
Yeah, that's
That's not someone that just gets infected.
That is congenital syphilis. Okay. Also, with congenital syphilis, they have something called saber shins, where their shin bones, their tibia, instead of being more or less straight, they're curved like an old-fashioned sword. That's also associated with congenital syphilis. Now, you probably are going to have other noticeable things as well. Developmental delay, mental retardation, neurological problems. Now, tertiary syphilis can be really nasty. Okay, now, some other things that may or may not be sexually transmitted. Lice and scabies. Scabies are mites. They are transmitted by close contact. Okay, so they are pretty contagious when people live together, when they are close together, when they share clothing or bedding. Scabies can be picked up by healthcare workers and then brought home to their families. Scabies typically cause an itchy rash. Lice, on the other hand, tend to be specialized for the type of hair available. So, for example, they have to hold on with their little claws here to the hair. So, for example, in the United States, lice is more of a white problem than a black problem, because white hair has a different shape than typical black hair. It's the other way around in Africa. Okay? In Africa, it tends to be a black problem and not a white problem. Okay? And it's because the lice have developed to have the ability to hang on to the hair. Okay? Now, pubic lice is not really any different than any other kind of lice, except for that it is found in the pubic hair. There they are. Little hairs. Okay, now, they have seen a decrease in the amounts of pubic lice because it seems to be becoming a thing for women to remove the hair from their external genitalia. Okay? Now, back when I was in school, you've probably seen this on Call the Midwives, which I'm not even that old, but they were doing it back then. Okay? One of the things that nurses did with the beginning of labor is they gave the person an enema and they shaved the perineum. Okay? That was because back in the day, people weren't giving themselves bikini waxes and all of that kind of stuff. Okay. As waxing has become more popular, the incidence of transmission of pelvic lice, pubic lice, has diminished. However, the incidence has increased is molluscum contagiosum. And I think I may have a picture somewhere of that. Okay, those are scabies. Oh, wait, those are lice. Lice have 6 little claws on those little legs, and scabies have 8. So there's lice, here's the nits. Now, when lice and scabies are treated, they usually need to be treated twice. Okay? Basically, they have to be poisoned, and then you wait until the eggs hatch out and then poison them again. Okay? The eggs or the nits tend to be resistant to the bug poison that you're using to get rid of the lice. Now, what you are using is a bug poison. It's a pesticide, so it needs to be used properly in the proper amounts. If it's not put on for long enough, it may not kill all the lice, and it may allow lice to become resistant to the pesticide. If it's put on too much and for too long, it can cause organophosphate poisoning, especially in people who are small, like children. Okay, so getting rid of lice involves using whatever it is you're getting to get rid of them and using it properly, and then cleaning the environment and all of the clothing and bedding. Okay, hairbrushes and all that. And it's pretty much the same deal for syphilis. Again, pubic lice are traditionally called crabs because that's what they look like. That's a little crab. You can have lice and nits in the eyelashes. Okay, that's what this is. These are nits in the eyelashes. It's really disgusting. All right, that's a scabies mite. Scabies mites are transmitted, and they also cause very itchy rashes. They cause an allergic reaction as they burrow into the skin. And again, you get rid of them the same sort of ways. Lice may or may not cause itching. Scabies do cause itching, okay, because they burrow into the skin. Okay, here's your scabies mite burrowed into the skin. Okay, laying its eggs. It's an allergic reaction.
And the itching is worse than mine.
Yeah, and they tend to make for creases, or areas where it's tight. So around underwear lines between the fingers sometimes with healthcare providers. Okay, molluscum contagiosum. Molluscum contagiosum is a pox virus. It can be sexually transmitted, but it's not necessarily sexually transmitted. And it produces little things that look like little stuck-on globs. They may have a little divot in the top of the glob, and there may be a little bit of cottage cheesy-looking stuff in it. Okay. They can be sexually transmitted in the pelvic perineal area, and they're seeing an increase in molluscum contagiosum as they see an increase in people shaving their genital hair. So that's what it looks like.
What is it, a bacteria?
Yeah, it's a pox virus. It's not a bacteria. It's a pox virus. These don't go away in a couple of days, but in somebody who is immunocompetent, they will go away. Take a few weeks.
And so what's the association with shaving the pubic hair?
They don't know. They think that what is happening is you're causing micro trauma to the skin, which is allowing organisms to gain a foothold that might not be able to otherwise. Now, the difference between these and something like herpes, for example, these are not blisters. These are fairly solid little bumps. You know, they look like a bubble, but they're not. They're solid, and they're not painful. Okay, but they also obviously shouldn't be there. So people are like, "What is this?" All right, very quickly.
How is it treated? What do they do?
Nothing.
It's a virus.
It's a virus. Okay, so they have to wait for it to just run its course.
You have to leave it off. And
The problem with lasing things off that are viruses is you gotta be careful not to aerosolize it because that'll spread it all over the place.
because it's a virus, is there the chance of reoccurrence? Or does it just go away and goes away?
It is, molluscum contagiosum is a pox virus, so usually once it's gone, it's gone.
We had one that had it on her chest when we were trying to breastfeed her baby because highly contagious.
No, breastfeeding her baby is going to be more beneficial to
That's what
her
we're told.
than infecting her baby with molluscum contagiosum. Okay, hepatitis. Some types of hepatitis are sexually transmitted, remember. Other types of hepatitis usually are not. Hepatitis A is a fecal-oral transmitted virus. Usually, it is transmitted by contaminated food or water, or somebody changing baby diapers and not properly washing their hands. Now, depending on what type of sexual practices are engaged in, think anal sex, for example, okay, can hepatitis A be transmitted sexually? Okay? Yes, but it's not the typical way that you see transmission of hepatitis A. With hepatitis A, jaundice, with all types of hepatitis, jaundice tends to be a huge part of the clinical picture. Remember, jaundice is yellowing of the skin and the sclera, and we're not talking about the creamy kind of sclera that a black person has. We're talking about pumpkin colored. Okay, that would be jaundice. Also, with hepatitis, you typically have hepatomegaly. Okay, the liver enlarges. The problem with hepatitis B and hepatitis C is that they can cause long-term liver damage. Now, hepatitis B and hepatitis C are blood and body fluid transmitted forms of hepatitis. Both hepatitis B and hepatitis C can be sexually transmitted. Everybody freaks out about healthcare providers and HIV. But historically, healthcare providers have been much more likely to develop hepatitis B, particularly OBGYNs. Okay? And hepatitis can progress to hepatic carcinoma and cirrhosis.
So the long and short is we should be testing everyone for everything.
The long and short of it is you guys need to be vaccinated for hepatitis B.
Do they have a vaccine for Hep C yet?
No. All right, now, all of these are viruses. Hep A, Hep B, Hep C are all viruses. There's a Hep D and a Hep E. Okay. Hep D usually goes along with Hep B, and it helps to make it more liver toxic. Okay. Hep C, again, is blood and body fluids. Okay, I have read some sources that say that hepatitis C is the one that is the most likely to be sexually transmitted. Now, all of these, since they are viruses, there are few treatment options that are real good as far as antibiotics go. They do use interferon sometimes with hepatitis C. Encourage the immune system to attack it. There are some newer drugs that are sometimes used with hepatitis C. Candidiasis or yeast infections. The pathogen type is a fungus. You have cottage cheesy-like itchy discharge with very red vaginal mucosa, perhaps the labia. I can identify it with the discharge with the hyphae on a wet prep. You treat it with some sort of a fungicide, usually an azole, and usually topically. Chlamydia is a bacterium. It produces cervicitis, which may be asymptomatic. It produces pelvic inflammatory disease that can cause prostatitis in men. It can also cause lymphogranuloma venereum. You culture it. You use antibiotics other than penicillin. Now, whether chlamydia should be still susceptible to penicillin, but why do you not give penicillin for chlamydia?
Because it goes hand in hand with gonorrhea.
Because it is so associated with gonorrhea. Either you have a dual infection, or if you're wrong about it being chlamydia, okay, gonorrhea in any case is going to be resistant to penicillin. Okay, genital herpes, a virus, okay, blisters in the genital area. Acyclovir is not a cure, but it diminishes the shedding of the virus and it diminishes the duration of an outbreak. Genital warts or human papillomavirus, the presence of lesions. The lesions can be removed surgically, they can be removed chemically. They are not typically lasered off because they are very easily aerosolized, and there have been instances of people developing genital wart lesions on their vocal cords, okay, from being in the area when they were lasered off. And again, sometimes the immune system will clear these on its own. Sometimes they will continue to recur, and they make the individual more susceptible to both genital cancer and cervical cancer. Gonorrhea is caused by Neisseria gonorrhoeae bacteria. It produces a very purulent discharge from the urethra, particularly in men. It produces a cervicitis that may be asymptomatic in women. It can also produce a raging pelvic inflammatory disease. It can go system-wide in both men and women, and it can cause blindness from producing ophthalmia in a newborn. Again, it's cultured and it is cured with ceftriaxone. HIV/AIDS, which I didn't even talk about because I get so tired of it, and you will too, because keeping your license current, you're going to be constantly having to do HIV training. Okay? Asymptomatic at first. AIDS is when you have the immune system trashed enough so that you are having opportunistic infections. It is detected with blood tests, and there are a whole cocktail of drugs that are used to suppress virus production. At this point, it is not considered to be curable. It's considered to be more of a long-term disease that can be suppressed by a proper pharmacological regimen. It can be transmitted by breast milk, and it can be transmitted across the placenta. Both of those types of transmission are diminished with giving the mother AZT. Okay. Pubic lice or craps, okay, itching in the pubic hair areas, presence of lice and nits, pediculicides, which are pesticides. Okay. Syphilis is a bacterium, Treponema pallidum. Primary syphilis is the presence of a rash, of a chancre. Secondary syphilis is presence of a rash. Tertiary syphilis is going to be irreversible damage to wherever it is that gummas are forming. Classically, central nervous system, sometimes cardiovascular system or other systems as well. You test for syphilis either by looking at the chancre, okay, which is hard and painless. You also usually follow it up with a blood test. Now, some of the earlier blood tests, the RPR and the VDRL blood tests, were indirect tests for syphilis. So they were sometimes false positives in people who had rheumatic diseases. The fluorescent test that they use now for syphilis is specific for syphilis. Okay. Also, in the past, they used to make people get tested for syphilis before they married. And the reason is they did not want a person to be married and not know that their partner had syphilis, because it could recur and then be transmitted to the partner. Also, it is a public health thing when you have a bunch of mentally retarded children being born. Okay, penicillin or other antibiotics. Penicillin is usually the drug of choice because it's the easiest. Okay, trichomonas is a protozoan. Frothy, foul, vaginal discharge, positive whiff test. Okay, it's treated with flagyl or metronidazole, as is bacterial vaginosis. Okay, questions?
With pubic lice, can you just shave the hair and that's the cure?
You can shave the hair and cure it if you don't have it in other places on the body. Okay, now before I let you go, okay, it's 10 minutes after 12, Amanda wants to see you. She wants to give you some information about your protocols. Okay, and she said that would take about 10 minutes. Okay, so that should still get you out of here by 12:30. Okay? Okay, and the quiz next week is just